Hello, my name is Rippelmeyer, and this is my head-to-toe video for advanced health assessment. This is my patient today, my wife Michelle. Before the exam begins, I had Michelle put on a gown, empty her bladder. I got a full set of vital signs, including her height and weight. And I checked her distant and near vision with the Snellen and the Rosenbaum charts. So to start the exam, I'm just going to start with her head. First, I'm just looking at her head and skull and scalp, making sure that everything looks symmetrical. I'm looking at her eyes, her ears, making sure that they're symmetrical. I'm looking at her hair, making sure it looks evenly distributed. Then I'm going to palpate, palpating her hair, making sure it feels soft and evenly distributed. Palpating the scalp, making sure it's freely movable, which it is. Palpating her facial bones, noting any areas of tenderness. Palpating her sinuses, same thing, feeling for any areas of tenderness or swelling. Now I'm going to palpate the temporomandibular joint. Just can you open and close your mouth? Good. Now it's feeling for any cracking or popping, which I did not feel. Then I'm going to check her light sensation of her face. So I'm just going to use a Q-tip and touch different areas of your face. And you close your eyes. Just tell me when I touch.
Mm-hmm. Yep. Yes.
Good. Okay, next I'm going to move on to Michelle's eyes. First I'm just looking at her eyes, I'm looking at her eyebrows, her eyelashes, and her eyelids, making sure that there's no drooping, that everything looks symmetrical. And I'm looking at her eyelashes, making sure they're growing up and away from her eyes, which they are. Then I'm going to look at her sclera and conjunctiva, looking for any swelling or redness or drainage, which I do not see. Then I'm going to palpate. I'm going to just feel all around her eyes for any nodules or areas of tenderness. And I'm going to feel the lacrimal apparatus. Good. Then I want to check the cover and uncover test. So I'm going to have Michelle focus on a point on the wall over there. And then cover one eye with your hand. Good. And then do the other. Good. And what I was looking for there is any nystagmus or extraocular eye movement or eye deviation, which I did not see. Next I'm going to move on to Michelle's ears. First I'm just looking at her ears, making sure they look symmetrical. Then I want to palpate her ears. I'm feeling the auricles, making sure that they are soft and movable. There's no tenderness. Okay. And then I want to look in her ears. Looking at the ear canal and the tympanic membrane, making sure it's pearly gray. Making sure there's no perforation, no fluid. Checking both ears. Good. And then I want to test her hearing. I'm going to do that with the whisper test. So I'm going to stand behind Michelle. Can you cover one ear? And just repeat the word that I say.
Soccer.
Okay. And cover the other ear.
Hockey.
Good. Next I'm going to move on to Michelle's nose. First, again, I'm just starting with inspection. I'm looking at her nose, making sure that the septum does not look like it's deviated from one side to the other. I also want to check patency. So can you close one nostril with your hand? And then breathe in and out. Okay, and do that with the other side. Good. Now I want to look in her nose. I'm going to move your head back a little bit. Okay, I'm looking at the turbinates, the mucosal membrane. Making sure the septum's not deviated, there's no perforation. Good. Next, I'll move on to Michelle's mouth. First, I'm just looking at her lips, making sure that they are pink and moist, which they are. There's no visible cracks. And then I want to look in her mouth. Can you open your mouth? Okay, first I'm looking at her tongue, looking at the texture of the tongue, color, making sure it's the same color throughout. Can you lift your tongue up? Looking underneath the tongue, looking at the floor of the mouth, making sure there's no signs of oral cancer. Looking at her gums, there's no signs of bleeding, which is good. Now, can you say ah?
Ah.
Okay. I'm looking at her uvula and her soft palate, her hard palate, and her tonsils. Let's see. And then I'm looking at her teeth. Noting the color, they're all white. She's not missing any. She has the correct number of teeth. There's no visible cavities. There's no mouth odor noticed. Looking at the very back of her mouth, can you say ah again?
Ah.
And the oral pharynx. Good. Next I'm going to move on to her neck. First I'm just looking at her neck, making sure that it looks midline. Looking at the trachea, making sure that it's midline. Looking at the thyroid. It does not look enlarged. And I want to look on each side of her neck for jugular vein distension, which I do not see. Then I'm going to palpate as well. First I'm going to feel the carotids one at a time, comparing rate, rhythm, and intensity. Okay, and I'm going to feel trachea, make sure that's midline. And thyroid gland, can you swallow? Okay, good. And with the thyroid, I'm making sure I didn't feel any nodules and that it felt symmetrical throughout. I'm also going to feel her lymph nodes. If the lymph nodes are felt, they should be soft, non-tender, and they should be movable. So we're going to start with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, deep cervical, supracervical, supraclavicular, infraclavicular. You can lift your arms up. I'm going to feel axillary as well. Good. Okay. Next, I'm going to move on to her. We'll do upper extremities. First, I'm just looking at her skin, noting that there's no injuries, no rashes, no obvious lesions. I want to look at her hands, looking at her fingers, making sure there's no cyanosis, no clubbing. I'm checking her capillary refill. Okay, and I want to also palpate her shoulders, feeling for any cracking, any tenderness, any obvious injuries. Okay, I'm going to feel her pulses, feeling her brachial first, and radial. Okay, we're doing side to side, comparing. Good. Okay. Next, I will check cranial nerves. We will start with the olfactory nerve. In order to test that, I'm going to see if Michelle can identify familiar smells. So you can close one nostril. Okay, tell me what that smell is.
Coffee.
Okay. And then close the other nostril. Tell me what the smell is.
Lemon.
Good. The next nerve is the optic nerve, but that was already tested when we did the Snellen and the Rosenbaum charts. Next, we will move on to the oculomotor, trochlear, and abducens nerves. In order to test these, I'm going to have Michelle follow my finger to the 6 cardinal points of gaze. Just follow. Good. And I'm looking for any extraocular eye movement or nystagmus. Good, which I did not see. And I'm also going to check her pupillary response to direct and consensual light. I want to make sure that they constrict. So direct and consensual. We're going to do both sides. Direct, consensual. Good. Okay, the next nerve I'm going to check is the trigeminal nerve. So in order to do that, I am going to use either a soft or a sharp object and touch different areas of her face and then have her tell me if it's soft or sharp. So you can close your eyes.
Sharp. Soft. Sharp. Sharp.
Good. Okay, the next nerve we are going to check is the facial nerve. So first I'm going to ask Michelle if you can smile. Can you show me your teeth? Can you raise up your eyebrows? Can you clench your teeth real hard? Can you blow out your lips and puff out your cheeks? Good. Now close your eyes. Keep them closed real tight. And make sure you can hold. Good. Keep them closed against resistance. Next we will do the acoustic nerve. So in order to do that, I'm going to have to do the Weber and Rene tests. So first we'll start with the Weber test. So just tell me which ear you hear that in.
Both ears.
Good, which is what we expect. And the Rene test. Tell me when you do not hear anymore.
I don't hear it.
Same thing.
And I don't hear it.
Good, and we'll check both ears.
I don't hear it. I don't hear it.
Good. Which is normal. Air conduction should be about twice as long as bone conduction. Next we will check the glossopharyngeal and the vagus nerves. So in order to do that, I'm going to look into Michelle's mouth again and have her say ah.
Ah.
Good. And I was looking at the soft palate and the uvula, making sure that they move symmetrical. And then I also want to check her gag reflex. So you can open your mouth again. Good. The next nerve I'm going to check is the spinal accessory nerve. So I'm going to, Michelle, can you shrug your shoulders? Good. Can you move your head side to side, forward and back? Good. And can you do that against resistance? Good. Okay. Good. The final cranial nerve is the hypoglossal nerve. So Michelle, I'm going to ask you to stick your tongue out. Move your tongue up and down, side to side. Good. And just making sure that she can move her tongue symmetrically and in all directions. And then, before I move on from her head, I want to auscultate. I'm going to listen to her carotid arteries using the bell of my stethoscope. And just hold your breath. I'm listening for any bruits. And the thyroid gland. Good. Okay. So now I'll move to her anterior chest. First, I'm just starting with inspection. I'm looking at her skin, looking for any obvious injuries or masses or lesions, which I do not see. And I'm looking at how she's breathing, making sure that she's not using any accessory muscles, that she's not working hard to breathe, that one side is not moving more than the other. After inspection, I'm just going to lightly palpate all over her chest, just feeling for any obvious masses or areas of tenderness. Okay, and then I'm going to feel her chest wall and her precordium. I'm feeling for any pulsations or thrills, heaves, and her apical pulse. Okay, good. And I also want to percuss. I'm just going to generally percuss all over. Just comparing side to side, listening for hyperresonance or dullness, which would be a sign of some fluid or mass or air. Okay, and I also want to do lateral, compare side to side. Okay, good. And then I'm going to auscultate. First, I will start with her heart. First, listen to the aorta, pulmonic, Erb's point, tricuspid, and mitral. Good. Then I'm going to listen to her lung sounds. I'm going to compare side to side. Take some real deep breaths. Good. I'm listening for any wheezes, crackles, any adventitious breath sounds. Okay, and I also want to listen laterally. Good. And before I move to her back, I'm going to do tactile fremitus. So I'm just going to feel, and then I'm going to have Michelle say 99. And I'm feeling for any hyper vibrations.
99, 99, 99, 99, 99, 99, 99.
Good. And then hyper vibration also would be a sign of like fluid or a mass. Okay, and then I'm going to move to the posterior chest. So I'm going to have Michelle turn around. Okay, same thing as the front. First, I'm starting with inspection. I'm just looking at her skin, making sure there's no obvious injuries. Looking at how she's breathing again. Same thing. I don't want to see accessory muscles. I'm making sure that her chest is not moving farther one side on the other. I'm also going to check her thoracic expansion. I'm going to put my hands down here and then have Michelle taking a real deep breath. Good. So I was making sure that my hands move apart equally, which they did. Okay. Next, I'm just going to lightly percuss or lightly palpate all around, just like I did on the front. Feeling for any obvious masses or injuries or tenderness. Okay. I'll do tactile fremitus just like I did on the front. Say 99.
99.
And I'm feeling for the same thing. I'm feeling for the
99.
hypervibration.
99, 99, 99, 99, 99.
Okay, good. And then I'm going to percuss, comparing side to side, listening for the same sounds again. Hyperresonance or dullness. Okay. And while I'm percussing, I'm also going to check her diaphragmatic excursion, see how far her diaphragm moves. So I'm going to ask Michelle to take in a real deep breath. Good. Hold it. And I'm just listening. Okay. You can breathe. And then I'm going to palpate, or I'm going to percuss up from that spot to blow all your air out and hold it. Good. Okay, good. And that's how much her diaphragm moved, which is within the normal limits of 3 to 5 centimeters. And then I'm also going to percuss her costovertebral angle. So Michelle, you just tell me if this hurts, which this should not hurt.
No.
Okay, both sides.
No.
Good. And I also want to listen to her breath sounds on the back, just like I did on the front, listening for the same things, any wheezes or crackles or adventitious breath sounds. One more. Good. Okay, now I'll move on to her abdomen. So I'm going to have Michelle lay down and just lift her shirt up a little bit. I'm using the pen light and shining it across. I'm looking for any pulsations. I'm noting the contour of the abdomen, looking for any obvious hernias or injuries or movements, which I do not see. Then I'm going to auscultate. I'm going to listen to all 4 quadrants for bowel sounds. Good. And then I'm going to switch over to the bell on my stethoscope and listen to her vessels. First I'm listening to the aorta and the renal arteries and the iliac arteries. And finally, femoral. And I'm listening for any bruits. Good. Okay, now I'm going to move on to percussion. I'm just going to percuss all around, listening to the tone. Good. Okay. And then I'll move to a light palpation. I'm just going to lightly palpate all around her abdomen, feeling for any obvious masses or any areas of tenderness. Okay, good. Then I'm going to move to a deep palpation. So this is to feel the specific organs. First I'm going to feel for her liver underneath her rib cage here. I'm going to push down real deep. Okay, good. And then I'm going to feel for her spleen, which you normally cannot feel unless it's enlarged. And then while I'm feeling for her spleen, I'm also going to percuss for her spleen. So I'm going to have Michelle just roll over onto your right side. Okay, good. And roll back. And then I'm also going to percuss for her liver border to give me the estimated size of her liver. So I'm just going to percuss down. Okay, marking the area where the sound changed. And then percuss from there. Okay, good. So then that's about the size of her liver. So then back to deep palpation. I felt her liver, I felt her spleen, and then I'm going to feel for her left kidney, okay, and her right kidney. Good. And then I also want to feel her aorta for any pulsations. Good. And then I also want to examine her abdominal muscles. So what I'm going to have Michelle do is just lift your head up like you're doing a sit-up. Good. And I was just looking for any protrusions that would be a sign of a hernia. So, okay. Next you can move on. You can sit on the edge of the table with you. I'm going to move on to her legs and musculoskeletal. So uncross your legs. First, I'm just starting with inspection. I'm looking at her legs and the skin on her legs, making sure that there's no obvious injuries, no lesions. Making sure that the hair distribution looks equal, which it does. I'm looking at the muscle mass, making sure that it looks symmetrical. I also want to feel her legs. I'm feeling for any edema, which I do not feel, and I'm comparing temperature on each leg side to side, making sure it's the same, which it is. And then I want to feel her pulses. I'm feeling the popliteal pulses, comparing side to side. Post-tibial. Good. And dorsalis pedis. Making sure it's equal on each side. Good, which it is. And then I also want to check muscle strength. So I'm going to have Michelle, can you pull your legs against me and then push? Good, make sure it's equal. And I'm going to check her muscle strength in her arms. So push up real hard. Push down real hard. Good. I'm making sure that was equal. Then I'm going to check her reflexes. We will start with the brachial reflex. We're going to do each arm. We're going to compare side to side. So and I'll just strike my thumb here. Okay. Looking for any signs of hyperreflexes. Okay. Her knees. And Achilles. Good. All right, finally I want to check her spine, so I'm going to ask Michelle to stand up. And then bend forward. Good, so I'm looking at her cervical spine and her lumbar spine. I'm making sure there's no noted curvature from one side to the other. I'm also looking at her general posture, making sure it's equal. I'm looking at her muscle mass, making sure that one side does not look bigger than the other, or that one side is not pulled further to the one side than the other side does, which they do not. So that's good, so you can stand back up. You can sit back down. Okay, and that concludes the head to toe exam. Thank you for watching the video.